Hi there. Happy Monday. I am, honestly, I was going to talk to you today about how to get well even if you don't have a diagnosis. And I am going to do that. But then I just got back from this great medical conference and I wanted to share some of that with you as well. But I'm going to talk to you about that next week. So I'm Dr. Shiroko Sokitch, owner of Heart to Heart Medical Center and the author of the book, Healing When It Seems Impossible, 7 Keys to Defy the Odds. And I always talk about my first key, which is love, and how important love is to healing. But then when you have a physical illness, you also need a physical treatment. And so the second key is about physical balance and about how to achieve physical balance in your whatever your health condition is. Now, I've been doing Chinese and Western medicine for 31 years, and during that time have continuously sought out the latest and greatest information on how to help you get balanced. And because of how I use Chinese and Western medicine, I have always used sort of the building blocks of Chinese medicine and then translated them into Western medicine to help a person find balance. And the whole point of Chinese medicine is that you can be healthy if all your systems are in balance. That ties perfectly in with functional medicine, because in functional medicine also it's about getting certain systems to work together, to communicate, and to be in balance. So I've simplified that process in my chapter on how to find physical balance by working with the following. So if you take both the concepts of Chinese medicine and the concepts of Western medicine and bring them together, if you have your hormones, your nervous system, and your immune system, if they are all in balance, then your body has the tools that it needs in order to heal. So even if you don't have a diagnosis, and I've seen over the years, literally thousands of people who come in saying, oh, all their tests are negative and they don't have a diagnosis, but they feel crummy. And if this is you, if you feel crummy and you don't have an answer to why you feel crummy, then what we do is we prioritize getting your systems into balance so that your body has the tools that it needs in order to get well. And I think, I love science and I love medicine and I love Chinese medicine, but I love Chinese medicine because it provides tools and answers in places where we don't necessarily have them in Western medicine. And I've been doing this for so many years. When I was a young physician, I was an ER doctor. And I remember I was studying Chinese medicine at the same time that I was working in the ER. And being, I think, a relatively young doctor, I still had sort of a flexibility in how I was thinking about things. And as I was learning Chinese medicine, I would see my ER patients and we would do all these tests and get all these questions. And sometimes those tests didn't show an answer. But then I would look at my patient from the lens of Chinese medicine, and I did have an answer. And so it's always been a part of my thinking to look at Chinese medicine at the same time that I look at you from the perspective of Western medicine, and now also the perspective of functional medicine, which has many layers of testing available. And my triangle of wellness is this. Actually, there's many ways in which I operate off of a triangle. One is the Chinese, the Western, and the functional medicine triangle of using all three of those tools to help you get well. But the second is, or the first really is, if your immune system, your hormones, and your nervous system get balanced, then we can have the tools that your body needs in order to get well. And so that is really where I operate from. And I've created a little quiz or a little questionnaire to help you understand your priorities in terms of getting well, if from those perspectives, so that you can kind of like look at your list of symptoms and see where they fit into the categories of hormones, nervous system, immune system. And then based on that, we prioritize that organ system or that system and help you get those things functioning. So I hope you found this information useful, and I look forward to helping you feel your best, even if you don't have a diagnosis. And that's the important thing, is to know that there are answers even when maybe there aren't appearing to be answers. And especially in our times where there are so many mysterious things, so many symptoms that we have that have evolved before maybe there was the possibility of having a diagnosis. And I've dealt with this with my patients for so many years, but it has increased in the last few years, I think, because again, more toxicity on the planet, the advent of COVID, and so much more stress in people's lives that affects how their bodies are functioning. I hope that you found this helpful, and I look forward to talking to you soon. Thank you so much. Please remember to go to my website and look for my book, Healing When It Seems Impossible: 7 Keys to Defy the Odds. Thank you, and have a wonderful day.